NMC CBT questions and answers. Question number 351. Patient usually urinates at night. Nurse identifies this as option A, polyuria, option B, oliguria, option C, nocturia. The correct answer is option C, nocturia. Question number 352. When should a penile sheath be considered as a means of managing incontinence? Option A, when other methods of continence management have failed. Option B, following the removal of a catheter. Option C, when the patient has a small or retracted penis. Option D, when a patient requests it. The correct answer is option A, when other methods of continence management have failed. Question number 353. What are the contraindications for the use of the blood glucose meter for blood glucose monitoring? Option A, the patient has a needle phobia and prefers to have a urinalysis. Option B, if the patient is in a critical care setting, staff will send venous samples to the laboratories for verification of blood glucose level. Option C, if the machine hasn't been calibrated. Option D, if peripheral circulation is impaired, collection of capillary blood is not advised as the results might not be a true reflection of the physiological blood glucose level. The correct answer is option D, if peripheral circulation is impaired, collection of capillary blood is not advised as the results might not be a true reflection of the physiological blood glucose level. Question number 354. Mr. Cross informed you of how upset he was when you commented on his diabetic foot during your regular home visit. He is considering to see another tissue viability nurse. How will you best respond to him? Option A, apologize for the comments made. Option B, tell him of his overreaction. Option C, explain that his condition will make him oversensitive to a lot of things. Option D, apologize and tell him to deal with the event lightly. The correct answer is option A, apologize for the comments made. Question number 355. When dealing with a patient who has a biohazard specimen, how will you ensure proper disposal? Select which does not apply. Option A, the specimen must be labeled with a biohazard. Option B, the specimen must be labeled with danger of infection. Option C, it must be in a double self-sealing bag. Option D, it must be transported to the laboratories in a secure box with a fastenable lid. The correct answer is option C, it must be in a double self-sealing bag. Question number 356. Which of the following is a guiding principle for the nurse in distinguishing mental disorders from the expected changes associated with aging? Option A, a competent clinician can readily distinguish mental disorders from the expected changes associated with aging. Option B, older people are believed to be more prone to mental illness than young people. Option C, the clinical presentation of mental illness in older adults differs from that in other age groups. Option D, when physical deterioration becomes a significant feature of an elder's life, the risk of comorbid psychiatric illness arises. The correct answer is option C, the clinical presentation of mental illness in older adults differs from that in other age groups. Question number 357. A 76-year-old man who is a resident in an extended care facility is in the late stages of Alzheimer's disease. He tells his nurse that he has sore back muscles from all the construction work he has been doing all day. Which response by the nurse is most appropriate? Option A, you don't work in construction anymore. Option B, what type of motion did you do to precipitate this soreness? Option C, you're 76 years old and you've been here all day. You don't work in construction anymore. Option D, would you like me to rub your back for you? The correct answer is option D, would you like me to rub your back for you? Question number 358. Mr. Bond also shared with you that his gums also bleed during brushing. Which of the following statement will best explain this? Option A, lack of vitamin C in his diet. Option B, he is brushing too hard. Option C, he is not using proper toothbrush to remove the plaque. Option D, he is flossing wrongly. The correct answer is option B, he is brushing too hard. Question number 359. In a community hospital, an elderly man approaches you and tells you that his neighbor has been stealing his money, saying sometimes I give him money to buy groceries but he didn't buy groceries and he kept the money. What is your best course of action for this? Option A, raise a safeguarding alert. Option B, just listen but don't do anything. Option C, ignore the old man. He is just having delusions. Option D, refer the old man to the community clergy who is giving him spiritual support. The correct answer is option A, raise a safeguarding alert. Question number 360. An 83-year-old lady just lost her husband. Her brother visited the lady in her house. He observed that the lady is acting okay, but it is obvious that she is depressed. 3 weeks after the husband's death, the lady called her brother crying and was saying that her husband just died. She even said, I can't even remember him saying he was sick. When the brother visited the lady, she was observed to be well physically but was irritable and claims to have frequent urination at night, and she verbalizes that she can see lots of rats in their kitchen. Based on the manifestations, as a nurse, what will you consider as a diagnosis to this patient? Option A, urinary tract infection leading to delirium. Option B, delayed grieving with dementia. The correct answer is option A, urinary tract infection leading to delirium. Question number 361. You are looking after an emaciated 80-year-old man who has been admitted to your ward with acute exacerbation of chronic obstructive airways disease, COPD. He is currently so short of breath that it is difficult for him to mobilize. What are some of the actions you take to prevent him developing a pressure ulcer? Option A, he will be at high risk of developing a pressure ulcer, so place him on a pressure-relieving mattress. Option B, assess his risk of developing a pressure ulcer with a risk assessment tool. If indicated, procure an appropriate pressure-relieving mattress for his bed and cushion for his chair. Reassess the patient's pressure areas at least twice a day and keep them clean and dry. Review his fluid and nutritional intake and support him to make changes as indicated. Option C, assess his risk of developing a pressure ulcer with a risk assessment tool and reassess every week. Reduce his fluid intake to avoid him becoming incontinent and the pressure areas becoming damp with urine. Option D, he is at high risk of developing a pressure ulcer because of his recent acute illness, poor nutritional intake and reduced mobility. By giving him his prescribed antibiotic therapy, referring him to the dietitian and physiotherapist, the risk will be reduced. The correct answer is option B, assess his risk of developing a pressure ulcer with a risk assessment tool. If indicated, procure an appropriate pressure-relieving mattress for his bed and cushion for his chair. Reassess the patient's pressure areas at least twice a day and keep them clean and dry. Review his fluid and nutritional intake and support him to make changes as indicated. Question number 362. What is an intermediate care home? Option A, it is the day-to-day health care given by a healthcare provider. Option B, it includes a range of short-term treatment or rehabilitative services designed to promote independence. Option C, it is a system of integrated care. Option D, it is a means of organizing work, that is patient allocation. The correct answer is option B, it includes a range of short-term treatment or rehabilitative services designed to promote independence. Question number 363. A patient with dementia is mourning and pulling the dress during night. What do you understand from this? Option A, patient is incontinent. Option B, patient is having pain. Option C, patient has medication toxicity. The correct answer is option A. Patient is incontinent. Question number 364. Nurses assume responsibility on patient with cane. Which of the following is the nurse's topmost priority in caring for a patient with cane? Option A. Mobility. Option B. Safety. Option C. Nutrition. Option D. Rest periods. The correct answer is option B. Safety. Question number 365. The nurse is caring for an immobile client. The nurse is promoting interventions to prevent foot drop from occurring. Which of the following is least likely a cause of foot drop? Option A. Bed rest. Option B. Lack of exercise. Option C. Incorrect bed positioning. Option D. Bedding weight that forces the toes into plantar flexion. The correct answer is option D. Bedding weight that forces the toes into plantar flexion. Question number 366. In going up the stairs with crutches, the nurse should instruct the patient to: option A. Advance the stronger leg first up to the step, then advance the crutches and the weaker extremity. Option B. Advance the crutches to the step, then the weaker leg is advanced after. The stronger leg then follows. Option C. Advance both crutches and lift both feet and swing forward, landing next to crutches. Option D. Place both crutches in the hand on the side of the affected extremity. The correct answer is option A. Advance the stronger leg first up to the step, then advance the crutches and the weaker extremity. Question number 367. When using crutches, what part of the body should absorb the patient's weight? Option A. Armpits. Option B. Hands. Option C. Back. Option D. Shoulders. The correct answer is option B. Hands. Question number 368. The nurse is giving the client with a left cast crutch walking instructions using the 3-point gait. The client is allowed touchdown of the affected leg. The nurse tells the client to advance the option A. Left leg and right crutch, then right leg and left crutch. Option B. Crutches and then both legs simultaneously. Option C. Crutches and the right leg, then advance the left leg. Option D. Crutches and the left leg, then advance the right leg. The correct answer is option C. Crutches and the right leg, then advance the left leg. Question number 369. What is the clinical benefit of active ankle movements? Option A. To assist with circulation. Option B. To lower the risk of a DVT. Option C. To maintain joint range. Option D. All of the above. The correct answer is option D. All of the above. Question number 370. How do you test the placement of an enteral tube? Option A. Monitoring bubbling at the end of the tube. Option B. Testing the acidity-alkalinity of aspirate using blue litmus paper. Option C. Interpreting absence of respiratory distress as an indicator of correct positioning. Option D. Have an abdominal X-ray. The correct answer is option D. Have an abdominal X-ray. Question number 371. What is the use of protected meal time? Option A. Patient get protection from visitors. Option B. Staff get enough time to have their bank. Option C. To give personal hygiene to patients who are confused. Option D. Patients get enough time to eat food without distractions while staff focus on people who needs help with eating. The correct answer is option D. Patients get enough time to eat food without distractions while staff focus on people who needs help with eating. Question number 372. What specifically do you need to monitor to avoid complications and ensure optimal nutritional status in patients being enterally fed? Option A. Daily urinalysis, ECG, protein levels and arterial pressure. Option B. Assess swallowing, patient choice, fluid balance, capillary refill time. Option C. Eyesight, hearing, full blood count, lung function and stomach site. Option D, blood glucose levels, full blood count, stomach and body weight. The correct answer is option D, blood glucose levels, full blood count, stomach and body weight. Question number 373. According to recent UK research, what is the recommended amount of vegetables and fruits to be consumed per day? Option A, 3 portions per serving. Option B, 5 portions per serving. Option C, 7 portions per serving. Option D, 4 portions per serving. The correct answer is option B, 5 portions per serving. Question number 374. If the prescribed volume is taken, which of the following type of feed will provide all protein, vitamins, minerals and trace elements to meet patients' nutritional requirements? Option A, protein shakes supplements. Option B, energy drink. Option C, mixed fat and glucose polymer solutions powder. Option D, sit feed. The correct answer is option D, sit feed. Question number 375. Your patient has a bulky esophageal tumor and is waiting for surgery. When he tries to eat, food gets stuck and gives him heartburn. What is the most likely route that will be chosen to provide him with the nutritional support he needs? Option A, feeding via radiologically inserted gastrostomy, RIG. Option B, nasogastric tube feeding. Option C, feeding via a percutaneous endoscopic gastrostomy, PEG. Option D, continue oral. The correct answer is option A, feeding via radiologically inserted gastrostomy, RIG.